Hey guys, came back here at the Battler workshop. Well, so we're not actually in the workshop at the moment. We're in my lounge room at the moment. I was going to do this outside the veranda, but the wind noise got up too much with the microphone, so we've adjourned inside for this one. Um, I want to give you an update as to where I'm at the moment. It's now been 4 weeks post surgery, and it's been 3 weeks post the catheter removal. So there's a lot changed in that time. So I want to go through that. I've kept the diary, and I've just put some pop notes down that I can go through, and I've got some little tips and tricks that may help out others going through this. Just before the majority of you flick off and go and look at other YouTube videos, I know I keep banging on about this, but there's a message out there, fellas, and that is you need to get your PSA levels checked. You don't want to be standing in front of your children or your grandchildren and telling them, I've got a year to live because of prostate cancer. This cancer is a slow growing cancer. If you get a track record of your PSA levels each year, if there's any changes, you can react to them and get something done. Don't be regretting or living the last year of your life and regret thinking, why didn't I go and do that? It's serious. Get it done. 90,000 men in America have a prostatectomy removal. It's rife in Australia. There's 55 men each day diagnosed with prostate cancer. It's the biggest cancer killer for men, but it is so easily avoidable if we get that PSA test done. So I urge you fellas, go and see your doctor, get the test done, get the blood test done each year on your birthday. Just keep on top of it. Get that record, that track record happening, please. All right, it is a simple message, but sometimes it doesn't get through, and we need to get it through. All right, let's start through this. As I said, I've made a lot of notes. So I've got a lot of pop-out notes with this, so it might get a little bit muddy, so please bear with me, fellas. We'll get through it. Look, I want to take a step back firstly, and that is on the catheter. I had an issue with the catheter. The top strap released, and it was a bit uncomfortable. I didn't realise it a relief until I got the pain, and that tube pulling down on your bladder isn't very comfortable. So I made sure from then on in I was wearing pants that I had a pocket that I could just pop down and I could keep my fingers on the strap, and I knew that it was in place. So it's a bit of a shock and a little bit of a jolt and pain when you do feel it. So if you can avoid it, just keep behind that top strap that holds that bladder bag, that catheter bag in place. So 3 weeks ago I had the catheter removed, and I was expecting it to be a little bit of a painful exercise, but it certainly wasn't painful. It was just a little bit uncomfortable, and it only lasted about 5 seconds, and I didn't even know the surgeon had actually finished when it was out. So not an uncomfortable experience at all. Sorry, not a painful experience at all, just slightly uncomfortable. So afterwards we went and sat down. We went through a few things with the specialist, myself and Rosemary. We hopped up and started walking down the street to the car, and I felt like I didn't need to go to the bathroom at all. I thought maybe I've dodged a bullet here. Hopped back in the car, didn't feel a thing in the car for the 20-minute drive home. Got home and went to get out of the seat, and I could not believe the weight that was pulling me back into the seat. When I got out, the pad that I had in, or the pull-ups that I had on, were absolutely full. And I can remember getting aside, peeling the pull-up back and having a look, and there I was peeing, and I could not stop it. I didn't know how to stop it. It was very, very confronting. When I tried to go to the toilet, I didn't know how to start it. It was also confronting. I didn't know how to stop. I didn't know how to start. I felt like Superman after he married Lois Lane and lost all his superpowers. Well, I'd lost my super stopping power and I've lost my super starting power. So um, I was very worried. I didn't know how I was going to get over this, and it's very, very confronting. And I'm sure that if you're going to go through this yourself, you're going to see exactly the same thing that I did. And don't be stressed, because it is normal. I went through 4 pull-ups in 6 hours that first day. 4 pull-ups in 6 hours, and I had no way of controlling. And that's one of the things in the surgery, is that men have 2 sphincters. Part of that prostate removal is one of those sphincters are removed. And it's a little bit like I'd imagine having your leg amputated and your brain's still trying to move your toes or your foot. but it doesn't because it's not there. It's the same thing with us. When this prostate is removed, that sphincter's not there. The brain's not keyed into the fact that it's not there anymore, and it's trying to make something move that, or trying to make something contract that isn't there. And you need to start retraining your brain into that new single sphincter. And part of that is the exercising. So I'll go through that a little bit later on. So as I said, yeah, very, very confronting. When you first come home, when that catheter is removed, you'll see that uncontrolled urinating, and you can't stop it. It doesn't want to stop, and it's not leakage; it's flooding. I can tell you, flooding. Um, I spent the rest of that week trying to get some control, and towards the end of the week, it was still very hit and miss, and I was still using the pull-ups, and there was still a lot of pull-ups that I was going through each day. So for me, it was. I didn't think I was ever going to get over this, but things did get a lot better. We'll go through that as we get through it as well. So it is frustrating. It's very exhausting. At the end of the day, you are absolutely exhausted trying to mentally control this, and physically and mentally, it washes you out. At the end of the day, you are just absolutely spent. Um, I was really concerned. I was going on about with my wife, and she's a very experienced nurse, but she said, "Look, I'm going to speak to somebody else just to let you know this is all normal." And she phoned up Continence Australia. That's a 24-hour helpline manned by continence nurses that you can talk to about what you're going through. And basically, what the nurses came back over the phone was pretty normal. Pretty, I got that reassurance that this is all very normal. Don't stress about it. It's going to happen, and you need to get used to it. And it's going to be a very slow and gradual recovery. I mentioned before the pelvic floor exercises or the Kegel exercises. They're an absolute must. If you want to start getting control of that sphincter, you want to start turning your brain into that sphincter and strengthen that sphincter, you need to start doing the exercises. Now, I went to a physiotherapist 3 weeks prior to my surgery. Now, unfortunately, I didn't go and see the specialist physio because she was away at the time. Another physio said, "Look, I can help you out with that." And what I was given, the exercises I was given, was absolutely nothing to do with that sphincter muscle. Absolutely nothing to do with it. So I wasted 3 weeks of that strengthening time up front. And I was pretty upset about that. A week after the catheter coming out, I actually went and saw a specialist physio with that. They use an ultrasound device that goes up behind your ball bag, and you squeeze and start working that muscle. And it's great because you can actually see it on the screen. So you feel it and you see it. It made so much of a difference. So I was with her for about an hour, going through a range of different exercises, looking at what was happening on the screen. So it gives you a good idea. When you're at home, you can't see it, but you can certainly feel it. And it was an absolute godsend. So I can't emphasize enough that you need to get those pelvic floor exercises happening as early as you possibly can. I'll put here, when you see the physio, leave your skin deep dignity at the door because everything is going to be out. She's going to want to see things moving up and down when you're exercising, all sorts of things. So leave your dignity in the door and just take it for what it is. It's going to help you enormously down the track with this. With that sphincter muscle, it's a muscle that you can't see. You can only feel it. It's not like exercising a bicep or doing crunches to increase your abs. You can't visually see the improvement, but it's a hard one to do because it's a hard one to get the feel right and get it happening. But you need to make it happen. When you're doing the exercises, don't overdo it. Don't strain yourself. You need to be gradual and you need to be consistent and you need to work on the technique initially. You need to get that technique happening. You don't want to be straining that muscle and upsetting it. Just be very gradual, but exercise it. And so I go through 3 sets each day, and I've got something like 60 or 70 of the contractions that I do in various stages or various types throughout that day, or throughout those 3 sets. Another thing, get out and do short walks. I started off thought doing a long walk. Well, that was a big mistake. I just flooded everywhere. It was an absolute mess by the time I got home. So just do short walks initially, that you know that if something happens you can get back quickly if you need to. Don't go at a bull at a gate like I did. Just do the short walks initially, and start building up your strength. You've had a major operation. It was major surgery. It's very traumatic to your body. Get out, get the circulation happening, get some fresh air, get your brain out into the sunshine, and start feeling a little bit better. And short walks certainly did that for me. Another thing I've still got, and it's probably going to be around for a while, and that is pain in that perineum area just behind your ball bag up inside your abdomen. Whenever I sit down, that hurts, and it's a little bit painful. So I sit down very, very gently on a cushion to try and spread that load out a little bit, and that's going to be with me for some time. It is uncomfortable, and sitting is uncomfortable. I try not to do it for too long. You try and mix it up between sitting down, standing up, or walking around. I'm lucky I've got the recliner, so I can lean back and stretch back and take a little bit of load off that area down below. So if you're feeling that pain, yeah, it's unless it's excessive, it's all very, very normal. Another thing you need to be careful of, or you need to keep on top of, and that is your bowel. So I use a softener before I go to bed each night. It's called Center Soft. Pop a couple of those. The last thing you want to be doing is pushing rocks out. You don't want to be straining with the surgery that you've had. You want to make that side of your life as comfortable and as easy as you possibly can. So look after your bowels, have a probiotic just to keep that those good bacteria working away inside you. Make that side of your life as easy as you possibly can. Get onto the probiotics even before you have the surgery. Keep them going, because, as I said, those narcotics they give you for the pain relief, double-edged sword. They'll take the pain away, but you'll certainly suffer like I did afterwards. It's very, very painful, as I said in that previous video. Stay on top of your hydration. I know it's a hard thing that you're going to drink or try and drink 1.5 litres, 2 litres of water a day, and you've got an incontinence issue. It's just going to make you wetter. Well, we just have to wear it. The last thing you want to have is a urinary tract infection with dealing with this. That's the last thing you want to have. It'll be 10 times worse. So try and keep on top of your hydration. Blood clots in the urine. Yep, I certainly have blood clots, and they've really only just settled down the last few days. So you mainly see them when you're sitting down on the pan and you're peeing into the porcelain. You'll actually see that crimson colour, and you may even see, and I saw just the odd small blood clot there as well. So that's all very normal as those blood clots shed down out of your system. And if it's pure blood you're seeing, you need to get back to your specialist. But certainly if it's just a very light crimson colour, as those blood clots wash out, that's all very normal with this sort of surgery. When I did my pelvic floor muscles exercises in the afternoon, I went and had a lie down for an hour. I thought that was fairly important, and the physio put me onto it, was to try and take that pressure off. When you're standing and sitting, you've always got that load on that pelvic floor muscle. Just lie down, flick on Netflix, a video, something, and just sit down and relax for that 1 hour, and just take that load off your feet, and just take that load off those pelvic floor muscles. And I found that's made a real difference for me as well. I've put on here Enjoy Your Showers. I have 2 showers a day, and they're absolutely heaven on a stick. One in the morning and one before I go to bed. And I'll probably take a little bit longer than I should, but it's the one time just having that nice hot water running over you that you feel a little bit freer. So enjoy your showers. Throughout the day, I have little projects, little routines that I had throughout the day. For me, it's my workshop, just going out, doing a bit of a tidy up, doing a bit of organising, nothing major. I'd always go and stoke up my potbelly stove in the mornings. I look forward to doing that. It was just one of those little exercises that I enjoyed doing it. It was always in the back of my mind throughout the day to go and put an extra couple of logs on, or go and stoke it. It was just something that I could do for myself throughout the day. Just take some time to smell the roses and just let your mind wander a little bit. And I did that mainly when I was lying down for that little rest in the afternoon, for that 1 hour rest. Just think about things that you want to do when things are getting better. As I said, just smell the roses a little bit. For me, this is not a linear recovery. It's very much a sawtooth recovery. And I have some great days, I have some good days, and I have some absolute crap days where the day is just an absolute write-off. You're just wet the entire day. It's very frustrating, but it's part of this recovery, and it's just something that we need to live with. And it's just very normal. It's a very normal part of this recovery. So don't be stressed if you find that you have really, really bad days that you just can't control. Like I said, just write them off, and think about the next day. It's a very, very, very gradual recovery from this surgery, fellas. So just be aware of that. Don't get too frustrated about it. Just wear it and move on with it. Avoid diuretics or anything that's going to irritate your bladder. But coffee for me is an irritant. There's certain foods for me that are an irritant that I know. I avoid them. I did have a decaf coffee from a coffee shop which has got the milk in it at 9 o'clock, and at 10 o'clock the whole day was a write-off. I couldn't keep up. It was just shocking. So for me, I learnt the lesson: stay away from anything that might, even though it's decaf, there may be a little bit in there that irritates you. The other thing I've knocked off too is milk. I had a bit of a look there to see if milk or any dairy products can be an irritant, and they certainly can be. So I have rice milk now on my on my Wheaties in the morning. For myself now, I'm 3 weeks post my catheter removal. I might just take a step back actually. At the 3 week mark, I decided that I wanted to get back into normal routine. So I'd spent a fair bit of the time back in the recliner, relaxing, tiptoeing around the house, just being very gentle with the way I move. So, and I did that mainly to aid my recovery from the surgery. But this week I've decided that I want to try and get back into life and get back into normal things. So at the end of last week, I was sort of down to, and these are the number 2 pads, I was probably down to one of those per day. But as I said, I wasn't doing a lot of activity. So this week I've decided to get back into the activity, and I started, obviously, I probably went through 3 or 4 of these a day initially at the start of this week. It's now Friday, and I'm down to one of these very thin ones. These are a level 2. That'll get me through the morning into the mid-afternoon, and right through this whole exercise, or through this whole recovery, I find that my afternoons, late afternoons and into the evenings are the worst. That's when I start getting uncontrolled leakage. It's usually because you're fatigued and you're tired. You have had a traumatic experience with that surgery, and you're recovering still. So don't be put off with the fact that in the afternoon things can get worse. So it certainly did for me anyway. So I'm now down to this number 1 shield in the morning and into the mid-afternoon, and then in the mid-afternoon till I go to bed, I'm 1 or 2 of these for the rest of the day. At night time, I have one of those in. When I do my first toilet stop at night, which is about 3 o'clock, I take the pad out and go to bed without any protection at all. And I haven't had any issues at all so far this week, touch wood. I can get up in the morning, I can go and make breakfast, put the cat out. I can do my first round of pelvic floor exercises without a pad in, without any issues at the moment. So that's great. It's great to have that feeling where you're not encumbered with those pads. But after the first shower, I pop the pad in, and as I said, I've still got the leakage, but it's not excessive. If you had told me 3 weeks ago that I'd be down to that in a morning and an afternoon, I would have laughed at you from where I was. There is no way in the world that would have lasted me 2 minutes. So there is improvement there, and in 3 weeks I've been very happy with my progress, and I've really put that down to the pelvic floor exercises, the Kegel exercises. They are so important, but you need to keep on top of those. You need to get that regime together and get those 3 sets in a day. So go and see your physio, get an appointment with a specialist physio to get that happening. Support. I had 3 of my workmates come over last night after work and sat down and had a beer. Well, they had a beer, I had a water. But it's great to catch up and start hearing about what's happening outside, what you're going through at the moment. And it's great to have that support. I get messages all the time on my phone about how things are going, what are you going, do you need any help. My neighbour's been fantastic. I've got Mike and Colleen on one side, and sorry, Mike and Carmel on one side. They've been doing my lawns and doing my edges for me, which is fantastic. I've got Mike and Christine on the other side. They're coming in with all these organic foods that he grows in his backyard, and he's been chopping up the wood for me for the potbelly stove. And that support from my mates, friends, neighbours, family have just been absolutely fantastic. Support from my wife, she has just been absolutely brilliant. So if you've got that sort of support around you, it certainly takes the edge off and gives you a little bit more comfort with what you're going through. Another one here that you mightn't think about too much, and that is finances. So at the moment we don't have any primary income because I'm off for the next 2 to 3 months recovering from this. If you've got the opportunity and you know this is coming up, start putting some things in place that are going to take some edge off the bills that are coming in. Maybe go and see your bank or your co-op. If you've got a home loan, to see if you can go back to an interest only just for the short term. See what things you can do, what arrangements you can make with your service providers to take some of the edge off those bill pressures that are going to keep coming in. If you can get some savings organised beforehand, get that happening. It is going to be a belt tightening exercise for that time while you're off work. You just have to look at how you're going to manage that best for yourself and your family. And I must admit, when the boys came over, they came around with a wonderful gift that everyone at the workplace had contributed to with a whip round, and that sort of thing is just fantastic. Absolutely, you haven't got words for it. It just takes so much pressure off when you get that little bit of help. It's great. So for the boys at work. All right, so I go and see my doctor in 4 weeks. So in 3 weeks' time, I'll go and get my tests done. I'll go back to the doctor, and I've just got my fingers crossed that it's going to be a zero result, an undetectable result. So after going through all this, the last thing you want to have in the back of your mind again is that you're going to have to go and have some radiation after this. But look, it does happen, and if it comes to that, we'll deal with it. But I'm just hopeful at this stage, because my cancer was inside the prostate. There were good margins all over. There was nothing detected in the lymph nodes that were harvested as part of the procedure. So look, fingers crossed, I've got an undetectable result. But I'll feed that back to you in 4 weeks' time, let you know where we're at. Right, so little tips and tricks. Leakage and flooding, yeah, you're certainly going to get used to that. One of the things I did early, the last thing you want to be doing is going to the toilet and trying to weave your way through a bird's nest of hair. Get downstairs, clean it up. It's very uncomfortable. If you can't control yourself, it's going everywhere. You're trying to get things untangled. Do a bit of clean up downstairs to make that a little bit more manageable. For me, I find it's worse when I've been sitting down for a little while and I stand up. You can feel the release of urine, that leakage. And sometimes it's a leak and sometimes it's a flood that you can't control. So from being a sitting down position to a standing up position for me is not good. It's even worse when you try and get out of a car, which is maybe a little bit lower. You need to strain a little bit more. What I do when I'm getting up is I tend to stay crouched over a little bit and then gently straighten up while you're walking. Yeah, it doesn't stop the leakage, but it makes it a lot more manageable. So my wife laughs at me. I look like Heidi Ho, the elephant getting up when I'm walking initially. But it takes a little bit of that leakage rate away. What I've done when I go out for my walks, and I like to be able to measure things to look at if there's been improvement. And it's very hard to see on those little pads. They have this little bullseye on there and they have this silk screen blue on it, and you can't really see if you're leaking very much, or you can't see what your leakage rate is. So I grab a woman's pad, and these are really cheap, they're only a few cents each. I peel the backing off and I fold it in half like that, and I tuck it into my jocks in front of my pad with the folded side down, because it will leak around quite comfortably. But I can go out for a walk and it shows up almost immediately when I get home as to what that leakage rate is like. I can actually visually see it, and I can see if there's been improvement from the start of the week to the end of the week. So it's a great little litmus test, these things. These are great too. If I have a shower at night, I'm going to stay up and watch a bit of TV, put the pad in, save you putting a fresh pad in before you go into bed at night. just pop one of those in. So when you go to bed, you slip it out, you put it in the bag, you hop into bed, and away you go. So, you know, they're very, very cheap. I find them too, they're a lot softer, a lot more more comfortable to be wearing as well. These are sort of a little bit papery and a little bit harsher, but these are very, very soft. But as I said, great for a little bit of a litmus test as to how you think your leakage rates is going during certain activities. When you go to the physio or you're going to lie down or anything like that, they'll ask you to get undressed, put the gown on, and try and get up on the table. Well, I did that at the physio and it was an absolute mess. Trying to strain and lift up and bend over, it was just going everywhere. So best thing to do is to lie down with your jocks and your pads still on. When you're comfortable, you're in your position, then take them off. Make sure you've got a box of tissues beside you and some sort of a rubbish bag or something that you can put them directly into if you're doing that to get yourself cleaned up, because it can be fairly embarrassing. Just in the car, I keep spare pads, pair of jocks and some bags just in the glove box of the car. Just if we're out and about and I have an issue, I've got something there that I can go to. That's, I know, fairly long-winded with all the things I've got so far, but look, I hope that helps somebody out who's about to go through. Sorry about that, my recording stopped. We'll start again. Yeah, so as I mentioned at the start, don't be too confronted by the fact that, or too worried by the fact that you don't have any control when that catheter comes out and you're just leaking everywhere. Those pelvic floor exercises are so important to start getting that brain tuned in with your in with that sphincter that's a little lone sphincter that's left on its own now. You need to start strengthening that and getting that into gear with your brain. And if you do that, you'll start seeing the improvements. Obviously, there's a lot of new medical techniques coming out now, a lot of new surgical techniques coming out, and there's one particular one that's out at the moment. It's being used in the US, particularly in some clinics in New York, and that is they're saving some of the ligaments in that area as well, and that's giving a much better result as far as incontinence goes. And there's some blokes the catheter comes out and they're fully continent, or if they're not, they're continent within a week or two. So there's new procedures that are coming out all the time. So if they're out, if you're going to have this done, go and ask some questions with your specialist and see if that procedure is available to you, that new surgical technique is available to you. So in the meantime, guys, I'm trying to stay positive. I am positive for the future. I'll check back with you in 4 weeks and I'll let you know how my results went with my specialist. And as I said, fingers crossed that I get an undetectable. So we'll see how that goes. For my YouTube machinist viewers, yes, I'm back into my slotting machine. So this is great getting out in the workshop and, as I said, having those little projects to do. So I'm painting up the body at the moment, and we'll start assembling that and getting that on the go. And this sort of thing, having that working away in the background, is just fantastic therapy when you're going through this, to have your mind active on something else that you can drift off into and focus on other things. If you can, get yourself a hobby, get yourself set up so that when you're going through this recovery period, you've got something else to focus on. It's so important. It's certainly helped me out. All right, guys. Well, thanks for sticking around. I hope that wasn't too long-winded or too muddy. So we'll see you with an update in around 4 weeks' time. But I'm hoping to have some videos out the progress of this, and it's not too far away. I'm expecting maybe another 2 videos and we'll see the thing in action. So we'll see if it's going to work, eh? Alright guys, see you soon.